How do you calculate safe days when you have regular cycle? It's actually very simple for you, like you're going to see in a few seconds. But you might ask, how important is that information? Now, you can use that information in two ways. The first one is, you want to avoid pregnancy, so you avoid the unsafe days. Or you can do the opposite. You want to become pregnant, or maybe you want to make someone pregnant, so you capitalize on the unsafe days like you're going to see. The next video should be, how do you calculate safe days when you have irregular cycles? That one is actually very interesting, and it's actually very simple, but you need some more calculations so that you try to pinpoint exactly when ovulation is happening. That's a very interesting one. Make sure you're subscribed and make sure the bell is on. Before we start, there is one thing I want you to understand. How do you calculate a cycle? It's quite simple. That first day you get your menses, that's your day 1. Let's say today is date 16. So if today is 16th, and this is when you're getting the first day of the flow. You're getting your blood today, that's the first day of the cycle. And the last day is the previous day before you start getting the flow for the next cycle. So let's say, for example, today was when you start getting your menses. So this is day 1 of this cycle, which is going to go all the way. But yesterday was the last day of the previous cycle. So that's how you determine the length of your cycle. And most of the time you find that majority falls under 28 days. This is just the majority, but it's normal to have a 21-day cycle, and it's actually normal to have a 34-day cycle. So anything in between here, it's actually a normal cycle. Now we have 3 types of cycles here. We have regular, which is if yours is 21 or maybe 22 or 28, it doesn't skip to, for example, if yours is supposed to be 21, it's like, let's say this time it went to 25, 26, or maybe 18. No, it doesn't. It's always at 21, 21, 21, 22 the same, 28 the same, so it doesn't skip. It doesn't go like, if this is 28, yours is 28, it doesn't go to 29, 30, maybe 24. It doesn't skip, so it's always 28. So that will be regular. We have irregular. This one, you can be, in this one we can branch this into 2. We have the first one, first batch, which is the very, very common one. This one is, let's say yours is 21. Next time you're going to find it at 22, or maybe 26, sometimes 30. The same case can happen to this or this one. So it doesn't give you exactly 28, but it's always within a certain range. This time it can be 28, the next cycle you can get 30, the other cycle you can get 25, so that's irregular. And this is the first type. The second type, it can be that you can take even years, or maybe 2 months, 3 months, 5 months without even getting that. So this one is complicated, and we're going to deal with it in a separate video because I believe we need to have more context in this one. So we're going to focus on this too. So by now we have context. Everything is clear. So let's just go to quick calculations. Now for our example, we're going to pick 28. Okay, let's not pick 20. It's so common. Everyone is doing it with 28. Let's pick 26. Yours is regular. It's always 26 each and every time. So how do you get to know when you have safe days and unsafe days? Now this is quite straightforward because now you see day 1 all the way up to 26. This is your cycle. So this is the first day of your menses. It can be any date. Like today, let's say today is 16th. So that will be day 1 of your cycle. And it goes all the way up to 26. It's actually this simple. So if yours is 26, you only minus 14. If it's 28 and it doesn't jump, so you usually get 28, 28, 28, 26, 26, 26. Your cycle is standard. So the same thing, you minus 14. If it's supposed to be 23, it's 14. If it's, let's say 21, you minus 14. And this will give you when ovulation is about to happen or when ovulation is happening. So you minus 14 from 26 here, you get 12. This is around when a person with a 26-day cycle is going to have ovulation. The same case happens to 28, which is the ideal, 14. So for this one, you'll go, let's say this is 12. And this is 14 for someone with a 20-day cycle. The same thing will happen to this person here. So this will be 9. This one should be 7. So if you go around 7, that's when ovulation is happening. So that will be the ovulation day. By now, I know you understand the concept. And I'm sure by now you can see something very interesting here. The shorter cycle, the ovulation is so close to when you start getting your menses. The window is very narrow here. I'm sure you've heard someone complaining that I had sex when I was on my menses and yet I became pregnant. So this is the reason. You find that this is day 1 and this is day 7. Let's assume that's day 7. You have a 21-day cycle. Let's assume this is a 21-day cycle. So if this is when you're getting your ovulation, it means that, you see, sperms can live for even up to 5 days. If you minus this, if you minus 7 minus 5, this means anything happening around the spot here, you're going to become pregnant. And mind you, this is when you're getting your menses. Some people can take even 4 days, 5 days, still getting the menstrual flow. Meaning that even at day 2, day 3, day 4, up to day 5, she's still getting her menses, and yet this is within the fertility window, because the sperms can be able to wait for the ovulation, which will happen on day 7, and when that happens, they'll find sperms there waiting for that egg, and fertilization happen. So that's one thing. Now let's go to how do you know exactly this is the safe day and this is not. Now we said we're going to use a 26-day cycle. So this is day 1 and it extends all the way up to 26. And remember we said if you want to know when ovulation is happening, you just minus the cycle. This is 26 minus 14, which will give us there should be 12. So you go all the way to somewhere there, this 12. Now remember, our bodies are not perfect. So there can be a delay or an addition in days. You know, moods, hormones here and there, the foods that you're eating, the environment can trigger either earlier ovulation or late ovulation. So to be safe, it's plus or minus 2. So this should be from date 10 all the way to date 14. This is her fertility window. Now, ignore this one completely. Now, let's go to this one because we want to know exactly when the safe days are. Now, remember we said sperms can live up to 5 days. They can stay, meaning that if you want to know exactly when the safe days are, you minus the duration the sperms can stay waiting for the ovulation. So if ovulation is going to happen here on 10th, which is the lower limit, how about we minus 5? So from date 1 all the way to 5, it's a safe day. The first day of the cycle, like we said, when you start getting your menses all the way to date 5. So this includes even the days you are getting the flow. So it's actually safe all the way up to date 5. Now, there is another thing here. Now, you see, we added another 2 from our the ideal ovulation day, just to be safe. The egg travels from the ovary all the way up to the uterus in 12 hours. But let's assume something happened. There was congestion on the way. Maybe I was traffic jam, maybe Palengara, Amasave. Something happened. How about we add just only 1 day here, just to be safe, 1 day. So that will be date 15. Meaning that now from date 5 going all the way up to date 15, this is a highly unsafe period. So this is when she can easily become pregnant. This is for the regular cycle. So if you do anything beyond this, okay, now from date 1, from the first day all the way up to date 5, if you do anything there, nothing will happen. If you do anything beyond date 15 all the way up to 26, this is still another safe day. So we have this one and we have this one here.